Today's topic is rib flare. In Turkish, rib means kaburga, flare means protruding. So, protruding ribs, which part of the rib is protruding? Ribs are generally attached to the sternum bone, but their lower parts are connected to each other and joined as a single piece. These are called false ribs. These false ribs join together as cartilage here and attach to the sternum. In some people, the places where they attach here can protrude outward. So, when we see outward protrusions in the area we call the arcus costarium or rib arch at the end here, like those individuals who have two bumps here, you must have seen them, we call this condition rib flare. We call this a rib flare deformity. Is there any harm in having a rib flare deformity? Rib flare deformities do not cause any health problems, but they can create an aesthetic issue, such as making the waist look thick when viewed from the side. Moreover, sometimes when lying face down on them, they can create pressure and be uncomfortable. Is there a way to correct rib flare? Yes, there has been a traditional method from the past to the present. With a new surgical method we developed in 2024, namely the Ribella procedure, we have made these surgeries scarless and incision-free. How did this happen? What did we do? Let me explain from the beginning. All types of rib flare deformities can be corrected without any surgical intervention in individuals under the age of 17, as their cartilage development is still ongoing. How is it corrected? There are two methods. The first method is bandage therapy. What do we do with the bandage? You wrap it around the patient's rib ends like this. This bandage is not like any regular elastic bandage. It contains steel wires and is a tight bandage that does not lose its strength even after years. It's called the rib flare bandage. Then pads like this come out from inside it. We place these pads exactly where the rib ends are, and in this way we increase the pressure at those points. For asymmetric cases, that is, when it's only on one side, the pad can be placed on just one side instead of both. Or for some people, follow-up with just a single bandage is sufficient. If the strength of the bandage is not enough to correct the rib flare, then rib flare orthoses come into play. Look, while a regular orthosis pushes the sternum bone to correct the pectus carinatum deformity, rib flare orthoses are designed specifically for the rib ends and apply greater force to this area compared to the bandage. As a result, rib flare deformities can be corrected without surgery in individuals under 17 years old. But after the age of 17, rib flare deformities become much more rigid. The cartilage development is complete. At this point, achieving a permanent correction with external pressure becomes almost impossible. So what is done in this situation? In the past, we used to perform surgery using the traditional method handed down from earlier times. What was this traditional method? We would make incisions of 4 to 5 centimeters in these areas and remove the protruding cartilages by delivering them out from within their membranes. And then we would suture the ends of these membranes that we had opened earlier. Afterwards, we would suture it to the surrounding tissues to create a new shape and then close up the patient. Within 6 to 8 weeks, the membrane would produce new cartilage tissue inside, and in this way, a new cartilage would form in accordance with the shape we had given, thus correcting the chest deformity. So what did we do? With the Ribella procedure we developed in 2024, we designed this process to be done without incisions or stitches. How did this happen? The main goal of Ribella was to narrow the waist. Our aim for ladies was to achieve the teacup waist curve by changing the shape of the lower ribs. But later we thought, could it also be effective in correcting these prominent rib flare deformities? We applied it and truly achieved very successful results. What do? We change the shape of the cartilage with needle tip-sized entries. Afterwards, we recommend using the rib flare bandage for 2 months. At the end of 2 months, the cartilage takes its final shape. The procedure takes less than an hour. It is performed under general anesthesia, but there is no pain, incision, or stitches. I have mentioned all these details. If you want more details, you can also contact our clinic. I want to remind you once again that you have the chance to correct rib flare deformities without pain, stitches, or incisions. Thank you very much indeed. I really do appreciate all of your help and support.